A 16-year-old female attends your dental practice for an appointment. She is fit and healthy but has a phobia of dental injections. During administration of an inferior dental nerve block, she becomes unwell and faints. What do you think is the most likely cause? A. Addisonian crisis. B. Cerebrovascular accident. C. Hypoglycemic shock. D. Myocardial infarction. E. Vasovagal attack. If you do not know the answer, watch the video till end, and do like and subscribe my channel. After watching video, you will understand the every option with explanation. First option is Addisonian crisis. Is a serious medical condition caused by the body's inability to produce a sufficient amount of cortisol. Low levels of cortisol can cause weakness, fatigue, and low blood pressure. But here our patient is healthy and fit, so this option is not suitable. Second option is cerebrovascular accident. Are caused by blood clots and broken blood vessels in the brain. Symptoms include dizziness, numbness, weakness on one side of the body, and problems with talking, writing, or understanding language. So this option is also not suitable because patient have no blood clot in brain. Third option is hypoglycemic shock. It affects patients with diabetes whose insulin dose is too high, either after an overdose of insulin or if prevented from eating at the expected time. So here patient have no diabetes mellitus. Here examiner also ask, what are the management of hypoglycemic? First. Before consciousness is lost, give glucose tablets or powder, or sugar, at least 4 lumps, as a sweetened drink, repeated if symptoms not completely relieved. Second. If consciousness is lost, give subcutaneous glucagon, 1 mg, then give sugar by mouth during the brief recovery period. Intravenous glucose, as much as 50 ml of a 50% solution, is an alternative but difficult to use in an emergency situation. Glucagon may be repeated once, but after that has no effect as all glycogen stores have been mobilized. Third. Hypostop, a gel containing glucose, may provide sufficient glucose absorbed through the oral mucosa to combat declining consciousness. 4. If consciousness is lost, call ambulance, provide oxygen, apply pulse oximeter if available, and move to recovery position. Next option is myocardial infarction. Here a patient typically has severe chest pain, but may suddenly lose consciousness as a result of a myocardial infarct. This option is also not suitable because patient have no chest pain. Last option is vasovagal attack. Is caused by transient hypertension and cerebral ischemia, is the most common cause of sudden loss of consciousness in primary dental care. The cause is peripheral vasodilatation, usually combined with an element of bradycardia. Examiner also asks how to manage the fainting attack. First. Lower the head, preferably by laying the patient flat. Second. Loosen any tight clothing around the neck. Third. If no rapid improvement, the legs can be raised or pressure applied to the abdomen to increase venous return. Fourth. Apply pulse oximeter if available, administer oxygen, give a sweetened drink when consciousness has been recovered. If no recovery within a few minutes, consider other causes of loss of consciousness. Yes, the last option, vasovagal attack, is correct one. Thanks for watching.